morning everyone, we are the group 4 and today we will be discussing about remotivation therapy. So today we will be introducing our members. First we have Ms. Risconia Angela, Mr. Ruiz Dylan, Mr. Salinas Vince, Mr. Secretarial Ram, Ms. Semblante Cerise, Ms. Sibal Bonzi, Mr. Santa Cruz Lance, and Ms. Supangan Jasmine.
Good day everyone, I am Ruiz Christian Dylan and I'm here to report about CL01 define the terms related to remotivation therapy. Affect. Affect is the reaction one displays toward an event. It is the outward expression of the client's emotional state. An example per affect is a friend has passed away, the reaction would be sadness and tears. And another example is a girl is emotionally sad and angry because of his boyfriend cheated on her. Then we have remotivation therapy. Remotivation is a technique of simple group therapy, objective in nature, used with a group of patients in an effort to reach the unwounded areas of each patient's personality and to get them thinking about reality in relation to themselves. Lagda. It is a Visayan word, a pattern or outline to be confirmed, a working principle, working rule, or a rule that is adequate to permit work to be done. An example of lagda is in sensory stimulation therapy, the client should only speak when it's their turn. Another example is the nurse should only administer the medication to the client if the client's physician ordered to administer the medication. Next is therapist, a healthcare professional specializing in the therapeutic medical treatment of impairment, injury, disease, or disorder. And we have environment, the circumstances, objects, or the conditions by which one is surrounded. Number 6, apathy. Feelings of indifference toward people, activities, and events. Apathy is when you lack motivation to do anything or just don't care about what's going on around you. An example is a student who does not care one way or the other if he passes the class. And another example is the field trip was cancelled because students were not interested in going to places. Then next we have disorientation. Disorientation is an absence of correct information about a person, place, and time. An example of disorientation is a person using a powerful drug might feel so disoriented that he or she did not know who he was, or where he was in time. Another example is a person saw his elementary classmate and was not able to recognize him. Next we have depression. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Number 9, emotions. A conscious mental reaction such as anger or fear, subjectively experienced as a strong feeling usually directed toward a specific object and typically accompanied by a physiological and behavioral changes in the body. An example of emotions are happy, sadness, anger, and fear. Next, we have conflicts. Conflicts is a strong disagreement between people or groups that results in often angry arguments. It is also a difference that prevents agreement. An example of conflict is people contemplating suicide have conflicting feelings about their desire to die. They frequently reach out to others for help. Another example is a youngster may want to go to a dance to feel that he belongs to a group and that's what his friends do. Next, we have delusion, a fixed false belief not based in reality. An example of a delusion is the client may think that food has been poisoned or that rooms are bugged with listening devices. Another example is claiming to be the daughter of the President of the United States. Number 12, hallucination. Now, hallucination is a false sensory perception or perceptual experiences that do not really exist. An example of hallucination is voices talking to or about the client, voices demanding that the client take action, often to harm self or others, and are considered dangerous. Another example is electricity running through the body or bugs crawling on the skin. Next, we have illusion, something that looks or seems different from what it is, or something that is false or not real but seems to be true or real. An example of illusion is an electricity cord on the floor may appear to patients with delirium to be a snake. Another example is a child who perceives tree branches at night as if they are goblins and may be said to be having an illusion. And number 14, we have therapy, a therapeutic medical treatment of impairment, injury, disease, or disorder. Number 15, disengagement. It is to release something that engage or involves, to detach oneself or to withdraw. An example of disengagement is older adults withdraw from society and personal relationships as they age. Another example is if an older adult who has heart disease may develop shortness of breath, may unable to continue daily walks with their friends.
Good day everyone, I am Georgie Therese T. Semblante and I'm going to discuss CLO number 2, which is to cite the goal of remotivation therapy. So remotivation therapy is an intervention which focuses on the capabilities and potential of individuals. So it's different from other therapies because it focuses on the abilities of the individual and not on their disabilities. So first, remotivation therapy helps value personal strengths of the client by recognizing their specific features, their roles, their unique traits. So, for example, we can help the client value the way they use healthy coping mechanisms when faced with stressful situations. Second is to help clients to think and talk. This is by aiding in relating and communicating with other group members. So it's more or less the same with the thought of having support groups where the client would be able to share feelings and situations with others who feel the same, and that way they can offer support to each other and help increase confidence. And lastly, we have the goal of remotivation therapy is to reach the unwounded areas by getting them to think about reality in relation to themselves. So this means that remotivation therapy is designed to reach the unwounded areas of an individual so that we would be able to encourage them to focus on these aspects of their lives. So this intervention or this therapy taps into these buried or dormant areas and reestablishes the client's interest in them by helping them in rediscovering this hidden aspect of themselves.
Hello everyone, I'm Lance Santa Cruz and I'll be discussing CLO number 3, discuss the purpose of remotivation therapy. First, to improve or maintain cognitive and physical skills, promotion of self-esteem, and increase hope and courage. Second, it is also utilized to monitor and assess any decline of the client's functionality in order to formulate interventions to specifically target it. Third is a suitable technique for preparing patients for other activities and treatments since it increases their willingness to do so. Fourth, can also be used as a tool to intervene with individuals of different ages with different characteristics and needs, from functionality independent individuals to those with dementia and high sensory, cognitive, and physical constraints. Fifth, benefits those who have dementia, those who need more sensory stimulation and are independent. Also, clients who are physically and cognitively able to participate but choose not to or choose to do so. And lastly, remotivation therapy is a technique for reaching out to non-responsive people and assisting others with their re-socialization abilities. So, as a result, the client's physical and cognitive abilities will be maintained or improved using this new technique.
Good day everyone, my name is Angela Rasconia and I will be reporting CLO 4, List down the indications and contraindications of remotivation therapy. Remotivation refers to a variety of group therapy techniques used with chronically mentally ill patients to stimulate their communication, vocational and social skills, and their interest in their environment. So, remotivation relates to the creation of interests in life, like, for example, interest in daily activities, talents, hobbies, and social relationships with their family and their friends. With that being said, our indications for this type of therapy would be individuals who are socially withdrawn, individuals who are ready for discharge, clients with a history of depression, and the elderly. Our contraindications would be clients who are aggressive, manic, suicidal, and homicidal.
Good morning, everyone. I am Bonzi Garrett H. Sibal, and today I will be discussing CLO number 5, which is Explain the Guidelines in Performing Remotivation Therapy. So, the following are the guidelines in performing remotivation therapy. First, a therapist and 10 to 12 people with different behavioral patterns must participate in the therapy. The patients must be arranged in a semicircle with the therapist in the center. The therapy should be done 45 minutes to an hour weekly. Clients should be questioned from left to right and vice versa. Before proceeding, the therapist should always establish trust from the patient. Encourage the patient to verbalize their thoughts and feelings. Answer and validate as much as possible when asked by the client. Do not cut off discussion. Do not dig into a deeper meaning. Do not confuse clients. Avoid your own judgment and criticism. And lastly, protect the client all the time.
So good day everyone, I'm Mr. Salinas Vincent Revi and I'll be reporting CLO 6. Enumerate the nursing responsibilities before, during, and after the remotivation therapy. So before, find and set a suitable environment. Introduce oneself and create a friendly relationship by establishing an open communication. In communicating, use both physical and personal interactions such as touch and maintaining eye contact. For during, ask questions carefully and politely, so questions must be tackled from a general to specific point. Acknowledge and give your full attention to what the patient is trying to convey. Take note of the verbal and nonverbal communication. Use open body language and avoid crossing legs and arms. For after, summarize the session and focus on the important ideas that were shared among clients. Give appreciation to the client with their efforts, attendance, and contribution. Inform the clients on the information relating to the following sessions and invite group members. Record observations and analyze the interactions made correctly and precisely. Document date performed and submit the record interaction to the psychologist or psychiatrist.
Hi, this is Jasmine M. Sapangan reporting for CLO number 7, which is to discuss the qualities of a good therapist. So, in this discussion, I will be talking about 11 qualities of a good therapist. So, one quality of a good therapist is client centered. So, this focuses on the client as the key to the healing process, which means taking a supportive role rather than a directive role. Because the clients do the work of healing, and within a supportive and nurturing client therapist relationship, clients can cure themselves. So, in this quality, it believes that each person experiences the world differently, and the clients are in the best position to know their own experiences. So, examples would be letting the patient choose who can visit them, allowing the patient to pick their own visiting hours, and inviting the patient's family members to participate in decision making. So, next would be unconditional positive regard. So, a good therapist needs to have this unconditional positive regard. So, This refers to a non judgmental caring for the client that is not dependent on the client's behavior. So it is more about accepting and supporting another exactly as they are without evaluating or judging them. So, unconditional positive regard promotes the client's self esteem and decreases his or her need for defensive behavior. So, some patients may have concerns about particular treatments that conflict with their religious or cultural beliefs. So, as they express their beliefs, be sure or a therapist needs to respect them and listen to any concerns they may have. So, a specific example would be when the patient is to be given a perineum care at the hospital setting, and this patient insisted that she doesn't want to do it as they have this family belief that only herself can touch her private parts. And so, the primary for this is to respect and teach them instead how to do it in order to meet the middle ground of the care. Third is genuine. So this refers to the realness or congruence between what the therapist feels and what he or she says to the client. So it's like doing a good deed without expecting a reward. So example, an elderly was discharged 3 hours ago. It's already 9 p.m. and you notice that she didn't uh, leave as she was waiting for the public bus, which is quite impossible to get transportation at that late time. So instead, you decided to give her a ride, as you not only have a personal car, but you truly care for the patient's safety. So next is a therapist needs to have this empathetic understanding. So this is when the therapist senses the feelings and personal meaning from the client and communicates this understanding to the client. So for example, your client and his partner were arguing because of a hospital bill, and instead of interrupting the argument at that moment or at that exact moment, you waited for them to be in a calm state before explaining to them that they can actually avail health services that offers discounts. Next, therapist needs to be a good listener. So this means listening carefully, attentively, and sympathetically, typically imparting support and understanding to the client. So good listening skills in counseling establishes trust, helps the client open up and disclose their thoughts, and encourages them to share their emotions. So thereby facilitating the gathering of valuable information about the client that would in turn aid the counseling process. So example, after the patient explained a lengthy situation, you were able not to cut him or her off during the whole time of conversing the message. And in the end, you were able to summarize her thoughts without adding or losing the message. So next would be multicultural sensitive. So this means emphasizing that the therapist has understanding of a client's background, ethnicity, and belief system. So therapists can incorporate cultural sensitivity into their work to accommodate and respect differences in opinions, values, and attitudes of various cultures and different types of people. So, for example, during discharge, your Armenian patient wanted to thank you by shaking your hand, and by culturally respecting them, you use your right hand in doing the shake hands, as you understood that when you hand to most Middle East patients, they find it disrespectful. So a therapist needs to be flexible. So this means creating a treatment plan that is individualized for each client, and this does not mean that the therapist needs to follow a rigid scheduled treatment or having this one size fits all approach. A study shows that some treatments are better than others for specific types of disorders. So matching the treatment to the stage of readiness that the client is is the most effective way to implement therapeutic techniques. And additionally, therapists need to be able to adopt and change course if treatment is not working for the client. So example, the patient requested to have his session scheduled every other day as he has his masteral classes. So instead of following the regular routine of meeting the client every day, you agreed to the request as it meets the middle ground of the care. Next would be patience. So this is the ability to endure the transition of the patient during treatment or care without complaints. Instead, we too understand the patient. So, as an effective therapist, one must be able to help their clients move towards changes. So, this process takes time, so one needs to be patient and willing to wait as the client gradually improves. So, for example, while assisting an elderly to the restroom, you noticed that they were walking too slowly. So, instead of forcing them to speed up their steps, you waited until they arrive at the restroom at their own pace. Next would be that a therapist needs to be or must be trustworthy, meaning that a therapist is worthy of sharing private, confidential information and parts of the client that are often entirely unknown by others. Because having faith in the quality of the relationship and the confidentiality of what is disclosed leads to a deeper connection with the client. So, example, the client was able to discuss a profound personal experience during the session, and instead of telling your coworker about it, you kept their personal information private and to yourself since you understood that this information is significant to the patient. So, a therapist must be optimistic as well. So, optimism or being hopeful is actually a great motivator and yet can be a challenging quality to master. So, this is the ability of being hopeful and confident towards the progress of the patient during the treatment. So, this means that the therapist needs to set realistic goals that engage the client and inspire a more optimistic outlook. So, as attainable goals are reached, clients will develop a sense of resilience and confidence that can help them areas of life. So these traits are why positive psychology is such an effective method of improving emotional health. So example is that a client who had been a smoker for 6 years came to therapy and told you that it would be difficult for him to quit. So the main action would be to reassure him that they have or he have the greatest potential to improve, which would lead to greater results over time. And lastly, a therapist needs to be self aware. So, this means having the ability to separate personal issues of the client. So, remember, Freud created this phenomenon called countertransference, where issues expressed by a client lead to an emotional reaction of the therapist. So, example, you were raised with ideals that shape you to be or to become pro-life. Yet your patient is expressing her views as a pro-choice advocate. So instead of disputing with the patient, you accepted her opinions and choices because you recognize that she has her own set of values that had shaped her into the person she is today. And that will be all for CLO number 7, which are the different qualities of a good therapist.
Good day, everyone. I am Mr. Secretaria, and for today, I will be discussing CLO number 8, which is 5 basic steps of remotivation therapy. So, we have 5 basic steps of remotivation therapy. So, let's begin with step 1, which is climate of acceptance. This is approximately 5 minutes nurse and patient interaction. So the purpose of this step is to provide a non-threatening atmosphere in which a leader or the nurse and the client can establish relationships and feel relaxed. So this is basically the interaction between the nurse and the patient in a comfortable setting in order to create a rapport. The next step is creating a bridge to reality. This is approximately 15 minutes throughout the session. The purpose of this is to create a bridge to reality by presenting a poetry or a song to the group or the patient that would apply to the theme of the session topic. So this step is basically helps to stimulate the patient to think of realistic topics that they may want to share with the group. The next step is sharing the world we live in. This is approximately 15 minutes nurse and client interaction. So the purpose of this step is to further develop the topic of the motivation session. So group discussion should be stimulated through the use of visual or audio aids and other physical props. Stimulation of client senses should be promoted during this step by having them see, hear, touch, or taste something objective in the world. Next, we have step 4, an appreciation of the work of the world. It is approximately 20 minutes of nurse and client interaction. The purpose of this step in remotivation therapy, it encourages the client to think about work in world as it relates to the topic of discussion. Work in world discussion also attempts to promote individual discussions about their past job experiences. Practical application of a job-related task may be encouraged for each individual. And last step, we have climate of appreciation. This is approximately 5 minutes of nurse and client interaction. So the purpose of this step is it terminates the group session. So this is the end of the discussion between the nurse and the client. So the client is given an appreciation for participating in the session. Anticipation for the next meeting is generated. So that's all for the 5 basic steps of remotivation therapy.